Just come up here. Okay, Angelina. Yeah, have a sit. Have a sit. Oh my God. Oh my God. Oh, you in pain?
Yes.
Oh my God. Let me get you some water, okay? I'm gonna get you some water.
Wow, so what do we have here?
My ankle. Somebody just attacked me. This guy, and I was running in Echo
What
Park.
are you, Echo Park? You mean Twisty Tony?
That's the guy.
Oh my God. I'll tell you what we're gonna do. We're gonna fix it for you.
Okay.
And we've got ideas for you.
Okay.
A lot of good ideas. Now, let me take a look here. Well, do you have any pain?
I'm in a lot of pain right now.
Now tell me about this guy.
Well,
Is he ugly like that?
yeah. He's really ugly.
Well, I'll tell you what we're gonna do. We're gonna take care of him.
Oh, I see you met my crazy partner.
Thank you.
He's been okay with you?
Yeah?
So what do you guys find out? What do you figure out?
Well, we know that this piece of crap,
Twisted
Twisted
Tony?
Tony, has been
That's the
attacking
guy.
an
That's
Echo
the guy?
Park.
That's the
I
guy.
told you, that's the guy. You guys see this guy? This is the Twisted Tony. And this is that criminal who attack people at the Echo Park when you run, when your ankle is never been rehabbed, when you spread your ankle in the lateral or medial way, it's always going to be there, and you're going to keep spreading this ankle. So Tony is always going to come to you, that criminal, and always put you in pain. So Angelina is today, we're going to work on her ankle. And the first thing, what we're going to do, we're going to do assessment. So let's get that table in the back. You want to say something?
Oh, are you a runner or anything like that?
Yeah, I like to work out, run, do Pilates. I do everything. I'm very active.
Can you do jumping jacks?
Yeah,
Not-
I can do jumping.
Not right now.
Not right now,
she's
yeah.
been injured, man. Come on, take it easy.
All right, all right.
So, what we usually do, we ask those questions. When the first time you spread your ankle, like the Tony, when you see the first time, see the Tony, Tony's spread ankle.
When did I see him?
No, yeah, when he attacked first time.
When he attacked?
Yeah,
It was, I mean, it just, I can't like move my ankle very well now. It's
On the
really
side.
hurting. Yeah, I can't put it straight.
so you twist it. It was
went- yeah.
twisted inside or outside.
It twisted, it's going in, it's twisting in.
Oh, it's twisted in. Wow, it's a medial twist.
You
But-
twisted like on this leg. You
Hold
went
on, we need
this
to
way
we
or
need to put this on
way?
camera.
Which way did you twist it? This way or that way?
This way.
Ah,
So this
an
way.
eversion.
Yes, eversion, correct. You see that David know a lot of words. So let's put this one away. And let's do some postural assessment. So we're gonna bring this camera here. We ask the client stand up. Of course, she's not in the acute stage, we just played, but get up. And what I'm looking for how she's standing and how this, you see that little shake up here. Are you sure you scared?
It's flat.
You see? So it's okay. And it's a lot of people get that twisted ankle to the side, or they've been spread this ankle for many times and it's come back. You see this bone exactly right there. It's gonna get this right in here. So if I put it right in here we go. This is the perfect. You see, and it's not create that. This is perfect arc, but if we drop it in, boom, right there. Did you see that? This is where that force is coming that way. And guess what? It's come to the knee. You see that knee is locked too. It's get this knee rotation, and it could be also caused the hip problem. And it's also maybe the hip problem was in the beginning, and it should all the way down. But we know that Tony has been attacking, get that ankle spread. Usually, like I said, people run, uneven surface, they step, that ankle rotate. Usually it's eversion, the ankle go inside, but here it's go to the midline, so which is it's a medial sprain. I'm gonna check the hip. I usually check with touching that hip bone, the anterior sacroiliac bone, and look at this It's pretty good. It's even, so I don't think we have a problem here. What we doing, we check, do some palpation. You want to add something, David?
Well, let's see now. So you're flat-footed, right?
Yes.
All your life.
Yes.
Well, that makes so much weakness. So it always has this tendency to pull in that way because of the flat feet. So you're vulnerable because of that foot there. Let me see the knee. Yeah.
Here we go.
Doesn't look.
Tony falling off.
Doesn't
So
look
he knows
too
we're coming
bad.
for him. That's why he's
It doesn't
down.
look too bad.
He's already
on
give
the
up.
knee.
All right. So what else what we can do here? We're gonna ask the client, Angelina, lay down on the bed. Let's remove those bands. And I got this leg up here, and you got so many, like you see, so many bones. But the thing is, when this slide off, let me get you. You see this tibia bone, it's kind of jammed between this calcaneus bone, and it's not enough space up here, so it's non-movable up here because this is slide that way. You can see that structure. We're also going to show you on that the skeleton dynamic on our application. And also this foot is dropped down, so a lot of stuff going on up here on those cuboid bones, on that metatarsal. You see this, everything is movable up here. Let's see how it's on Angelina. So Angelina, go ahead, lay down, face up this direction. This leg is down this way. And we're gonna add this camera now. Let's take the socks off. No, David is gonna help you.
Okay, so this is the one.
Yeah.
All right.
So we're gonna just put it up here.
We're going to move this up here. Well, when you got an ankle problem, you could have a knee problem. Did this knee ever bother you?
Yeah.
It has.
There we go. So we got a lot of information right away. Knee, ankle problem, it could be the hip problem, the knee problem, because remember the knee is always problem below or above. So,
Well, you take a look at it first.
me, all
Because
right.
I'm about to lose my temper.
Why?
I fell off my horse yesterday, and he kicked me right in the ass.
Okay. Oh, wow. Okay, as usual, I don't use a lot of oil. So what we're doing here, we keep doing assessment. We see how strong the thing is here. Remember, I showed you this very cool test. If you didn't watch it, we're gonna do it again. Let's see if Christina Angelina. Oh my God, if I say this to my wife, I'm probably gonna be dead now. But good as just a client, okay? Just the case, okay? So let's see if Angelina like to running. So what we're doing here, we did show this test a couple times. I'm gonna resist that and push this foot down. She's gonna resist me. So I'm gonna push against me, push very strong. Look at that, it's like super strong. Now, let's send a signal Angelina is running right now and see how the strength is gonna change. Because remember, your body control everything, your brain control everything in you. And this is the simple test for this runners. If your body like to run, you get that knuckles and you start doing this. Like imagine she's running, especially on this bad ankle. Because body, you okay?
No.
You in pain? Okay. Yeah, we like torturing people here. So the thing is, your body try to protect you. So let's say I like to run, but my brain don't like to run because he don't like to be in pain. He'd like to get this ankle. And just maybe like 1 minute, 30 seconds, 1 minute. So I'm running for her. Even the spine is not in gravity. Now watch. Let's try resist me again. Resist. Boom. You see, I win. with 2 fingers against the whole leg. Just think about it. So it's a one test. Another test, I want to test this ankle. Is that is the ankle moving? No, it's stuck. It's going that way. Look at that. It's very nice, but it's not going inside. So internal rotation is not working. External rotation is working. So it could be the problem here. Could be a problem here, why it's not moving. Let's say dorsiflexion, plantar flexion. Try to bring it. Perfect. And extend. Very good. Now do on your own. Try to bring flexion, extend. Very nice and smooth.
Is that pain? No pain,
No pain?
right?
Yeah, always ask about pain. Thank you, David. So you see, it's very nice. It's movable. So what we have, it's not rotate inside. Let's check the hip. We also have to check the hip. We bring this to 90-90. I'm gonna put my badge away. So internal, external rotation of the hip. What we're doing here, look at that, how flexible she is. She over flexible here. And this way, wow, this is like almost 90. So no problem with hip. We didn't check the stability, one leg standing. Always do that too, see how person stand. We don't want that right now because she's been a little bit injured. So what I'm doing here now, what else we can test?
Well, I want to know
Yeah, what you want to know?
is how you injured it when?
Earlier.
This week?
Yeah.
And were you were running? Was it in a hole? You stepped in a hole? How did it happen?
Yeah, I was running and I just got
Twisted, yeah.
Twisted it, yeah.
You were running on the street.
Echo Park.
Echo Park.
Yeah, remember the Echo Park? They're
Echo
all up there.
Park, Echo
yeah,
Park.
exactly.
I know you're a busy man.
And then after that, did it swell?
No.
No, you never had swelling.
Well, a little bit. Maybe a little.
And did you put any ice or heat or anything on it at that time?
Yeah, I put some ice.
Big mistake. Every time you spread your ankle, do not put the ice. You want that area congested fast as possible. When you put that ice, you try to, I understand, get this pain away, but the healing processes get slowed down. So a lot of people put some ice. I highly recommend do not do that, and try just maybe elevate it and hang up here. Do not put any compression socks because, like I said, the blood is want to circulate and wash this area and heal that area as fast as possible. So this is my message to you. Yeah, it's a good questions, and it's happened many times. If you get this ankle injury many times, you need to do rehab. If you didn't done rehab, it's going to continue happening. The twisted Tony is always going to be on your ass. So you're always going to wait for you till you run again and do something again. Especially right now, it's raining. It's a little bit might slide, and I see a lot of people, doing this stuff. So, what else you want to do?
Well,
You start working?
I want to find out, yeah. So I'm going to do some palpation and find out.
Okay, here we go. Palpation is great.
Well,
Palpation is already half treatment goal.
Well, let's see. So now, let me see here. So this muscle here could be sensitive.
Well, let it go.
What do you feel in
She's
here?
she's scared. She's scared that Tony is the bed damage now.
Oh,
Does this feel sore?
no.
No, it don't feel sore.
It feels good. It feels fine.
Yeah.
Yeah.
Okay. Here. All right. And let's see here. How is your now? What about your Achilles tendon?
It feels okay.
No pain.
No.
So palpation, it's a good part of the treatments. Oop.
And let's see. What about here?
Oh, yeah.
Okay.
A little painful there.
And here?
Mm-hmm.
And what about up here? Not as much. So on this lower, on the
So what do you find out,
this
Inspector?
her Achilles tendon is got a strain on it. It's very, very sensitive.
Yeah, so palpate, always ask the client what's going on. All right, we're gonna start our face up position. This is what I usually do. And what I'm asked the client to do, just scoop a little bit this way so the leg is gonna be in a little bit out of the table. Here we go, just like that. And make sure it's on the camera. Like I said, I don't use a lot of oil. 2 drops, 2 drops. What I'm doing here, I'm get that 2 thumbs like this, grab the whole foot right in here, grabbing the whole foot. And I find that space between that calcaneus bone and that tibia. And what I'm doing here, create a lot of, like try to create the space. What I'm doing, I bring this to the dorsiflexion. And I put this 2 finger gently in this area. You okay up there?
Yeah.
Some people very sensitive. So I'm trying to create space. I can hold, ask her to push against me. If it's too much, if person too strong, watch. Let it go. Put your quad. You see she's against my quad. And you move your quad forward and backward. Yes, David?
Now, when you pointed your foot, was there any pain on that?
Yeah.
A little bit. Not bad.
Yeah, when she's, go ahead, push against me. Do you feel
No,
pain?
No.
Good, okay. So stuff like that. I'm working on that. Joints. I want that moving. You see this little wobbling up here? Next one, I come up on that heel, lock it in, get that on the top, the right one. And what I'm doing here, I'm stick out and a little bit open up. Remember, we want all this bones is moving. Is that okay?
Yeah.
Good. Just like that. You can do single one. Some people do single. They hold and they do single metatarsal. But I like to do the whole thing. Stick in, rotate. Stick in, rotate in all different directions. You doing okay?
Yeah.
Okay, here we go. Big pop. I don't rush myself. If poppets happen, it's great. If not, it's also good. Come back to this motion again. Something stick up there. Someone spilled the coffee on the floor. Okay, here we go. Next one, I want to open that foot, get that more space. If you see on this camera, I'm open up. How's it feel?
Good.
So my finger is coming this way. It's like open book, so I'm pull it out. You see, I'm pull and my fingers go that way. If you pass me that foot, David, the skeleton, I will show them. The single separation. And this is in the air. You see the foot is in the air? So this is what I'm doing here. Grab like this, and I'm open this up. So I have to go that way, but you guys understand. So I grab and I pull, pull. Next one. Talus joint right in here, and I'm trying to get some space. This is what I'm doing. Pull and move. Right in here, okay? Especially for her, it's slide a little bit to the side. Let me get this down. And you can see when she's laid down, her foot is like this, right? So scoop up a little bit. Scoop up a little bit. Just, here we go. So her legs is on the floor right now, and it's still, you see, it's kind of pointing out. So what's happened here, I think this is one like overstretch. What do you think, partner?
Well, she's
I can't believe I called
a
him
very
partner.
confusing case because you're saying this is where
She said medial, but that was probably lateral sprain. because you see, this is what's happened to her. It's easy to go that way. That's what she's thinking. So it was a lateral sprain.
You think you went this way.
I thought I did.
Oh, okay.
You're not. You're pretty sure.
Yeah.
Are you 100% sure?
He was behind. He was being.
I don't know. It happened so fast.
Yes, exactly.
And it could, but this
Exactly.
way, it could have been this way.
Yeah,
Yeah, I couldn't.
could be in this way. Correct.
Have you ever sprained your ankle before?
When I was young.
There we go. You see?
And you don't know which way that was.
Wow.
I
So
was like a
Tony,
little-
Tony attacked when you was young.
see.
Aye, such a Tony bastard. Those Tony twist ankle. Oof.
Look, with one finger, you can just easily, it just goes right over.
But that's okay.
Yeah.
This is everything is correctable and fixable. So what we have this lateral strain of that ankle. So this fascia, everything on the side is need to be supported. And guess what? If you guys gonna start loading your body with the weights, with the running or what's that, Pilates, single leg, it's gonna get more damage because this ankle unstable. So we need to create stability in this ankle. Let me finish what I'm started. I usually sit inside, and what I'm doing here, let me go on my knee. I grab that one part, upper butt and a partial, and my lower portion of the foot. And what I'm doing, I'm just start twisted side to side. You probably see on this camera. Yeah. So, and create that space. Get that more. How's it feel? I'm always talk to my client. How's that feel? Now, I can grab the two thumbs coming right on that foot. This one is on the top of the portion of the foot. I put this on the dorsiflexion, grab that top, whole fingers. You see, I'm not doing 2, 3, whole of them. On the top, and I start to decompress very gently.
No pain, right?
No pain? Great. Yeah, she don't feel pain. There we go. And I feel that. Some people start to force a lot, like they pull it. Don't do that. Very gently, especially if you massage therapist, don't cross your scope of practice. But the bands, it's not out of scope of practice for massage therapists. They're always there. Doing okay right there? Yeah, I do a little bit more, put like more pressure. I did 5 pounds. I keep this in. There we go. Feel okay? You can do on the bottom, on the top, a little bit decompress, decompress that hip too. Why not? And she's already up. I want to do work on hold this tibialis anterior muscle. If you scoop a little bit more up, so it's going to be more comfortable for you. Here we go. So what I'm doing here, we've been talking about this many, many times, but we keep showing 2 drops. 1, 2. Oh, third one, but it's come up. Here we go. What I'm doing here, I'm working on that line, on that anterior kinetic line, superficial, deep line. And remember, when the foot is come this way, we have that cross line. I forgot the name. I think it's a cross line, lateral line, also effective. And what I'm doing here, I use my one arm and gliding this up. Doing okay?
Yes.
Okay. And now she can start move with me like she's moving that foot. I ask her to move. You see she's moving and I keep working on it. Here we go, big pop. You feel that pop? Feel good?
Yeah.
I always like when something pop.
The best.
Exactly. You see, people think it's the best. Sometimes it's
So
not.
satisfying.
Yeah. So next one, I can work on that directly tibia. You can also use your knuckles like this. You see the more pressure, and you can, yeah, pull it out. And all the way up to the knee, and you drop right there on the side. Again, you can ask her to move the foot, help her out, see how this muscle is moving, and that's approach. Next one, I want to strengthening this muscle. Remember, we have some sprain. So I come up with my favorite band, come up here, and might get my hands inside it, or pull a little bit on the side and ask her to move that foot up and down, like a pedal. No, like a car pedal. You can go around it. Toes. Here we go. So what she's doing now, she's activating those muscles, and you can work on them. You can work, you can feel that. You feel any pain?
No.
Go all the way up to the knee. And this is the treatments.
Right there.
Right there? Okay. You just hold it.
Yeah, a little right there. Very, very slow.
Yeah. So you can, yeah, go ahead. So if you can see on this camera, touching those, there we go, something just pop. Yeah. And if she feels sore, just work on it.
It's more just
Good. Let it go. Now I'm apply pressure. Remember, her ankle is coming this way. So I am coming out inside the leg, and go ahead and ask you to start moving this way. Here we go. And you see how fast she's dropped back. Look, you see how fast she's go back? This muscle is not supporting her, so it's fast. To reactivate it, you just hold back other way. Ask her to spread this leg like this and start doing that. Here we go. If this is roll, that's fine. Hold on, let me just adjust it. And guess what? When this ankle is going to be for so many problems, you're going to start wimping. And if you start wimping, it's not going to be good. So spread this leg a little bit like this. And here we go. What she's doing now, here we go. Look at that. Look at this. You feel that? She feel this right away, and it's go all the way up to that hip. This is already treatment. Can I work here? Yes. Look at that. Yeah, look at how this all those tendons I can see comes up right away because she's working hard now. Look at that. And this is going to be her homework. Lay down on the ground, on your floor at your apartment or house, and just do that. Attach the band somewhere. Do the same. If you're tired, do both. Just one. Outside and in. There we go. All these different directions. Come up here. Same thing. Pull towards your body and away. Look at that. The idea is very smooth and nice. Move that ankle. If it's like shaky, you need to definitely work on it. Also, you can work on calf this way. I really like, yeah, I'll show you one of the technique. You can bring this one up here, this band. She step on that band. What's going on around this floor? This is so sticky. And you can come up on her knee. You see? Boom. What she's doing now? Pedaling, like a gas. Look, all these muscles. I can work on it? Yes. Look at that.
Now, does that hurt? Does that hurt doing?
No.
Does it feel weak?
no.
Yeah, you can do this way. You can sit down. You can work on that calf. You see? You work on the calf muscle here from this side. Look at that. And she's doing the homework right now. I'm not doing anything. You know, I can pretend I'm doing something for her, but yeah. Oh, it's good. Yeah, that's what I usually do. Yeah. And that's how we do it. So, let's see if we did something. Let's retest that ankle. Look at that. Is that moving more? Yes. I will definitely work on that part of the body too, on that knee. What I'm doing here, I usually jam that foot so it's not moving. If we put this camera a little bit up here. So what I find out that joints, and I start moving. That tibia, rotate, is that any pain? You can also test the knee if she have a ACL knee problem, SEL being damaged. It's also going to shows up. So you're going to grab that knee and you pull, and you feel that if the knee is wobbling, you need to do something about it. Or you ask those questions if she's been experienced knee damage before. ACL, what's anterior, cruciated ligaments. Yeah,
ACL.
ACL, ATL. Oh my God, all these letters. So, and this is what I'm doing. She's very good. I'm moving around. I grab the knee, just move that fascia, see if this is moving. Yeah, everything is moving. And this is what I'm probably going to do in this position. I can also work side, but let's David to work on that foot first.
Okay, well, I'm going to work on it this way. Here, let me
Yeah.
take a look at it.
And yeah, it doesn't, we show you this more like a physio massage and soft tissue manipulation or classic therapy, which is great. And both way, it's help your clients. So don't lose your badge.
Well, let me take a look at it here. Now, you've had problems.
I was a dancer at one time too.
Okay, so you were a dancer and you never had any ankle problems, but your knee may have hurt you when you danced?
I would block sometimes, maybe.
Do you have more issues on this side generally than
Yes.
this?
Yeah, I would say, with my legs, yeah.
Well, I'm going to take a look at the soft tissue here. So I'm going to take a look and see. So you're a very interesting case. No, you had a little bit of swelling, but you can move it around. It doesn't feel very swollen. You've got a lot of really good things. You are lucky.
Yes, I am. I am very blessed and lucky.
All right, let's see now. Now, when I pull into here, it feels a little bit tight in here. Does it feel sore or tender in here? Like right here.
Yeah, maybe a little like lower.
It's very much harder
Yeah,
here.
right there.
Okay, now, when Jay was working on you, I noticed a couple of things.
Yeah, but I don't work on the calf muscle because I said I'm going to flip her face down, but you already start working on the calf muscle. God damn it, that manual therapist.
But to tell you,
massage therapist. Oh my
when
God.
I
Now
put,
you spread the oil everywhere.
I have oil. I have.
Everywhere. He's
It's
like
like
a
I
gallon of
dumped
oil.
her in oil.
Yeah, that's what he's doing.
I feel like fried chicken.
Fried chicken. Tastes like chicken. Look like chicken.
Now, I can feel her Achilles tendon has problems. Now, your problem was when you would walk. You were having trouble walking.
Yes.
That's the worst problem that you had. Okay. And when you were walking, was your problem back here or over here on the top here? Where did it hurt when you walked? Here or maybe back here? Or here or here?
On the side or
There.
inside?
On the inside.
Inside.
Right
Yeah,
here.
Yeah.
Anything back here?
A little when he was pressuring.
But not when you would walk.
No.
Okay. So let's see here. So when people are face up, I can warm up and do the entire thing and I take a look at it. Now, do you feel sore here?
A little. Yeah.
Is this where you might have been feeling some of your discomfort when you would walk?
Yes.
Okay. So she doesn't have any movement in these little fibers all in here.
That's well, yes.
But you've been doing good. You've been doing good. I'm proud of you. And so I'm just going to do a little bit of warming up here, and then what do you want to do? Put her face on the side.
I want to get the catch the Tony, twisted Tony, man. If we're gonna spend all time on this ankle, we're not gonna catch him.
Okay.
So we just have to explain people what we're doing
All right,
here.
all right.
Our future detectives and try to catch the
Okay.
Tony.
She has big problems on this medial side of her Achilles tendon. This entire thing on the medial side is much harder than this side. This side doesn't feel,
That side feels tighter.
okay, this side feels tighter.
The
What is this?
wicker-
How about
the,
this?
The wicker muscle is feel tighter because
Yeah.
her foot is pronated this way. It's a everted. Yes, and that's why she feels so sensitive up there, because the foot, like I said, she's step this way. This is the foot, she step, this is overstretch, this is weak, and this is get inside it tight. So
All
you
right.
always see, the most common, it's a lateral strain, not the medial strain. So
So she doesn't have a lot of movement on, mostly from her Achilles tendon down. She feels it a lot on the lateral. There's a
Okay.
medial, her Achilles tendon, and attachments into here, and some of the fibers in the soft
You
tissue
see, yeah.
right on the bottom. This is very rigid. It's a classic case.
that's what I kind of like those the classic massages, because they palpate very good. They can feel that the hypertension in the body, and where is that exactly the problem. But we already tested, right? We already know that. He didn't open anything new for us. All right, so we're gonna. Are you
her.
done in this?
Yeah.
Okay. So let's flip her face down. And what we're doing here, yes. This is the new one. Yeah. we just changed it for you. And let me get this right in here. So this camera is not going to see a lot, so only this camera. So what I'm doing here, I bring this leg and I'm start pumping. I can pump this way. I can place my forearm, grab that high heels, and just pump, and ask you to resist, push up, relax, and do pumping. Pumping real good. And see how she feels. You doing okay? And also see that hips is any related. You see, I like to do this kind of stuff. If this is hip pops up, it's also related with the hips. For now, for next one, people do, let me take my badge away. They like to go this way. You place a pillow or some sheets. They kind of lean on that. I got too much stuff going on here. All right, I've never released my disco gold, but this time, okay, I'll do it. So, my badge, because it's a magnet. Okay, here we go. So I'm make sure it's nothing up here, so it's not gonna, and you see I'm lean on it, and I can lean forward and work that muscle. This is a one way. So one way this way. My favorite one, it's grab that foot and start doing that. Twist it. Twist it away from the body. That's the motion, you see? I'm twisted this way. And this arm is coming that way. So I create that cranks. I think this way is going to be the best to see it. Here we go. So bum, 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 bum. And what I feel, yes, it's right in here. Also, you can pump and drag down. Right there, you feel that? Right in here? I feel that Again, rotate, open that fascia bags. Again, come back this way, push down, rotate the whole, make sure it's no pain. You doing okay?
Yeah.
How's that feel?
Good.
Ask her to push against me, so she push up on my belly. Let it go. There we go. Rotate in and out. And I'm gliding down. Do I use my the hands? No, I use my whole body. So I'm just gliding my whole body down and work on that. Right there. Yeah, she got a lot of stuff going on here. Come back again. And work up. Can you pass my bands, please? Black one. Yeah, just black one. What I want to do here, again, we're going to work, activate the muscles. I come up here, down, and ask you to move exactly. That's what she's doing. If you want, we put this on her knee, just like that. Here we go. Work. See? And you can just hold the band, and she's working. Yeah. And you can work also here. You can stand up, work here. Whatever you can do. The bands, it's the great tool, and it's never going to hurt. People are going to say, oh, I feel it. Feel that weakness. Do you feel anything? You see that this create that loop between your brain and that non-working muscles, and it create that loop. It's come back and it start activated. So that's what you band. That's loop. Let it go. Next one, what else we can do? Remember, we can do outside, inside. So she can start doing this. Bring her heel. You can, if right here, bring in and out. She's working on that glutes. Create that relationship between your hip and your ankle too. You see how she's struggling to go inside. You can help her out a little bit. Maybe this band is a little bit too much, so always ask, what about outside? You sit outside, you stand on another side, go, look at that. And you see how, and she start raise this up, the gluteus. The hip is coming up. You see she's trying to struggle here a little bit, but that's okay. And this is what you do, all this group of muscle. Remember, this ankle is collapsing this way, so we want to create something here, right? I come up here and ask her to rotate. I'm going to help her out. That's it. See, I'm helping. The band is pulling, and I'm helping with the arms, show her the way. She started doing it on her own. Yeah, you see? There we go. Yeah. Stuff like that. That's fine. That's because she don't know how to do it. And it's a lot of people don't know. And after, you can also work on that plantar fascia, which is we're going to add this to Bobby plantar fasciitis case. I usually use my forearm, and I start dragging that fascia towards that heel. And I give her homework. After David has done his treatment, we're going to give her a little homework. And just like that. And see how she feels. Don't forget to work on the hamstring, activate the glutes. Oh yeah, always check the glutes, because the glutes is going to tell you if the problem is present. What I'm doing here, I'm usually doing the knuckles and squeeze the glutes. Here we go. The glutes is pumps up right away. A lot of people, so she's sporty, she do some active sports, and that's what the glutes is active. If glutes is not active, it's going to be a problem for your lower back, for your hamstring, for your quads, ankle, everything is going to be suffer. But the glutes is good. So you can check between, squeeze the right one, let it go, relax. Yes, it's good. I can feel that the action, the reflex is there. So use the bands when you work on that ankle. Now it's time for David.
All righty. Well, let's take a look at this. So now I know a few things. Well, the first thing I want to do is, let's see here, I want to work on this Achilles tendon. So I'm going to warm it up here. And I'd like to get a bolster. That would be nice. Okay. Okay, so I'm going to put her ankles on this thing here, like that. I know it's a little cold there. All right. All right, so what I'm going to try to figure out right here is how to fix this thing. He did really good. So I'm going to feel. You feel very sore in here, right? Okay, so this is very, so I want you to see something. This is harder. This whole thing, it clumps. See that clump? Clump, clump. Well, you ain't supposed to have that. Right, right. So, but it was an injury, so I'm going to let you get away with it this time.
So tell us, what are you doing, David?
So I think we have a problem with her Achilles tendon.
All right.
And so I am going to warm it up a little bit and soothe it out so she can get a little more freedom in here.
Freedom.
Now it feels sore when I do all this. So it feels a little, this is like one of the worst spots, right? Right on the attachments. So her attachments to her Achilles tendon. Now, Mr. J right here, well, he did some fine work, I must say. And he warmed up a lot of things, saved me some time.
Ah, you bastard.
So, and so I'm going to try to get a little bit of movement in here so it won't hurt so much. I'm just doing it by hand and I'm going in here. So this pressure's okay, right?
Yeah.
Okay. I'm feeling it here. And so what I'm doing is I'm just doing it by hand and I'm warming it up and I'm working on her. Now her calf is going to have a little bit of problems too. So I can find where it is. Right here. Here. Most of the pressure, most of her troubles came from that Achilles tendon. Again, those rats, that Twisty Tony, he's always attacking Achilles tendon. But it's better than being kicked by a horse. Let's see here. And I'm just getting this here. And a little looser in here. Now, how about here?
It's okay.
That's not bad, right? Okay. Okay, let's see here.
Are you gonna use all oil in department?
Yes.
Jesus, we got only 1 gallon left. So if you guys like the oily massage, that's
Look
what
how
you're doing.
oily she is.
Yes, she's ready to cook. Let's fry her up. Okay, it's
All right.
Yeah, it's a good thing. I'm just gonna show you one more thing. Maybe David, can you want to tell him what's
And
this?
this is gua sha,
Correct.
and you could go in and you can use the gua sha this
Yes,
way.
it's a also metal tool. They got like a titanium. This is like it's also work. It's a jade stone, and it's really good to gliding and yeah, doing that. I saw the couple video people like scrape the skin out of the people. This is a little bit too much, guys. I think I don't know, fascia. If you like torching people, it's good. If people like to be torched, I understand that because some people like to feel pain. But definitely, just be gentle, scrape that, glide that fascia, and it's yeah, it should be fine. You feel that you find that points?
Mm-hmm.
Good. That's what we can do, but definitely we can tape that on the side. The tape is good. Some people get this compression socks. Like I said, you want that blood circulate in this area when you sprain your ankle. And if it's bad spread, of course, see the doctor, do x-ray, make sure if this has changed the color, specifically it's a blue, very lot of blue color, like a purple, definitely do x-ray, MRI, just make sure it's nothing been broken up there. And the key is, yeah, always start get that rehab right away as far you don't feel pain, because if you're not going to do rehab, you're going to keep spraining your ankle, especially if you like running basketball game. Basketball is very common. I know the basketball players come in, they like 4 or 5 times spread the ankle. They never did any rehab, and it keeps damage that. So yeah, what else you want to add something?
Well, so that basically that treatment is good with all that working out that you just did, and I'll tell you what, it is where it is. It's just a little bit of her Achilles tendon's a little bit jammed, but not that bad after all that warming up you did. So
You did good job
she's
too.
going to be able to move. We can have her. We could test her out.
The classic massage mixed with the physio massage is always best benefits. So
Do you want me to have her stand up?
stand up. Well, let's let her to sit up, and we're gonna give her some homework. Right,
All right.
maybe right in
I'm going to
here.
stretch it just right here like that. Does
Yeah.
that hurt?
No.
In the middle. And what we're going to do, we're gonna go around and put this right in here. Bam. You see what she's doing? If the band is too tall, here we go. Now you start doing this. Like rotate and up. I think the band is like try to do this way. There we go. This band is a little bit too much. I mean, it's too long probably for her. This because this is my size. We can do this way, and she can step on that here. Step and extend up. There we go. Watch. Yeah, this is the best. You see what she's doing here? What she's doing here? She's yeah, she do those exactly.
Inversion.
All those muscles start. Were you doing okay? You feel that?
Yeah.
Good. And it's a bunch of exercise. There we go. That's one of them. And what else we can do here? If we favorite one is create that arc. I always tell the clients, go ahead, step inside, put this on your foot like this, spread, and you can turn up here. And what you're doing here is start doing this. Yeah, you see, no, like rotate in and out. Yeah, here we go. And I would say maybe get some more stretch, pull more. Here we go. Especially in this one. You see what she's doing here now? Yeah. And if you, David, give me that long band. Oh, it's right in here. Here we go. This is the first one. This is like so light and easy exercise. Perfect. How do you feel? You feel that? Okay. Yeah. Next one, it's coming from the side. You can leave that band up there. I'll step this one inside. And I want to get this one up here. And she's doing the same thing. So how she's doing it, she attached to the door and Here we go. Just, don't let me rotate. Here we go. I probably put too much pressure on her. Yeah, here we go. Look at that. The ankle is start working. Look at this. He's going to create that.
To create an arch.
Yeah, create that arch. 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 Whatever. Голеностоп. Ёб твою мать, блядь. Okay, and this is good. All right, so yeah, you can release that band. Also, remember, this ankle is kind of collapsed. What I'm also teach people to do, attach to the door, to the wall, Sweden wall, whatever. Just make a lot of pipe trees, and go ahead, turn face this direction, and I come again that one right in here. And what she's doing now, no, here we go. Get this one back. No, get this leg back. No, back. This one is back. Step to me. Here we go. She started leaning that knee forward. You see, and back. Like you step forward, like a lunges. Here we go. And what I'm not doing, I'm trying to not, she's not collapsing there. You see? And that's what we want to do. And so, of course, it's going to take time. Look at that. And I'm more and more. And I release it. Try to make a couple steps. See how you feel. Does that feel different? Yeah, it's feel different. Okay.
Feels better.
Good. Next one, you're going to turn face towards the wall. And I want you to squeeze that block. Here we go. You see, she squeezed that block. And now she's going to do step on her toes. And hold that block. Don't forget the block. Keep squeezing them. Here we go. Look at that. Perfect. How's that?
Good.
Exactly. Ooh, I'm here. Yeah. Here we go. This is great. Look at that. She's squeezing that. It's not make her ankle collapse inside. So when she squeeze it and raise this up, raise this up, it's good. Let's let it go and try to see how you feel now. Yeah, we keep working on that. It's more physiotherapy on this ankle to get that strength.
Feels good.
Feels good.
Yeah.
Also this way, step on it, and just roll. There we go. Use the tennis ball, lacrosse ball. So she's roll it up and down. What she's doing, she create that arc. And that's what we're doing. That looks great. Here we go. And it's, like I said, bunch of those exercises you guys can do for your ankle collapsing. And it's, like I said, I show the simple ones. It's so many I can just keep editing and editing. Let it go. See how you feel. Try to walk a little bit. Yeah, we definitely need to work on that ankle more and more. Yeah. It's better.
It is a lot better. Oh, it just popped.
It's popped because it's go to the knee. Remember, her knee was locked, and now she feels this in the knee. You have something to add?
Yeah, there's the one, so you're on the floor.
There we go.
I like this one. So, I'll show you what it is. You're like this. And this is going to go up, down, up, down. So I'll show you.
Okay.
You can do it.
This is great exercise
It's incredible, perfect for you, because it'll stretch out your Achilles tendon. Here. And I know it's gonna go.
Go on the second leg. Put them on the both.
Oh, both.
Yeah, now pull one towards your body. Let it go. Let it go.
Yes.
Let it go. Your arms.
It's gonna go on this.
There we go. Okay. Now you can lay down.
Now you can lay down.
Don't worry.
So
We got some coffee all around.
Right.
So
now this is the one that needs to be worked.
It's a bicycle. Here we go. Now hold this one down, and this one is just doing that.
That's her right
And
one.
you can grab this.
Yes.
Yeah, that's wrong one.
Yes.
Switch.
Yes, just switch.
You can do both. You
Okay,
always do both.
So, yes. So this is
and
gonna
now
go here,
up and down.
Here, hold on. Let me get this.
There we go. Twisted
Band.
Tony, Twisted Tony, Twisted band.
This
Everything is
strengthening
twisted.
all that.
Yeah, she's working on that hip flexors also, and that TBL muscle, and that ankle. Perfect. Yeah, it's in the beginning always gonna slide, but when she's find out, it's gonna be better.
Hold on a second. I'll bring this foot down a second. I want to get this right. Just so here. Okay. I want to put it on here.
Do you think people are gonna watch hour-and-a-half-hour videos? I don't think so.
You're going to hold this.
Maybe 20
It's
minutes.
going to go now. I want you to just bring this.
There we go.
Feel that? Is that hard? Bring it up.
Yeah,
Not too bad.
right there.
I feel it in my hip.
Yay! And that's what we're looking for. And it's a many exercises. Like I said, we keep showing you guys.
Yeah.
And let it go. Let me help you out. All right, so I hope we're gonna catch that Tony. How do you feel, better?
A lot better.
Okay, our victim is can be walk now. Angelina. Hey. So subscribe, guys. Get your cases. If you're around Los Angeles area, if you feel like something bother you, pain, give us a call. We can come to your house, help you at your house. We have a clinic here. We can work on your clinic. If you want to be one of our guests in our show, always fill the form below, and you're welcome.